Can you put yourself on mute, please?
Sure. Okay, Dr. Shaquille is good. He'll be on in a moment.
Okay. I'm gonna start the Facebook Live in like a minute. So just warning everyone.
Were you able to get Kathy's email out?
No, I was not.
Okay.
Good evening.
Good evening, Dr. Shaquille. How are you?
Good, how are you?
Good, good, good to see you. You're
Dwight?
going to be in like silhouette because the light is in the back of you.
I can close the curtains.
That would be good. Thanks.
Dwight, if you want to let Kathy know, I was able to add her.
Oh, okay. I just told her. Let me call her back.
Okay, I'm going live on Facebook now. Dwight, just FYI, I can unmute one person at a time if needed. So if Kathy doesn't get the other link, I can unmute her when you want her to talk.
Okay, that's good. Thanks, Swati.
I think you're muted.
Swati, what do you think? Are we ready to start?
Yep, looks like we have about 15 attendees. So,
Okay, well, thanks, Swati. I think if we're ready to start, I'll go ahead and start if you're okay.
yeah,
Okay, awesome.
please.
Great. Well, let's go ahead and start, everybody. Hey, everybody, welcome to our town hall, our COVID town hall today.
Thanks.
Hey, Scott.
Hey, Scott.
Okay, let's go ahead and start. Welcome, everybody, to our town hall. I'm Scott Coleman, and I'm running for county commissioner in Collin County next year. And it is Sunday, February 14th, and we are having a snow day in Texas. And I don't think we've had this kind of snow in a long time. I know that in 2011, we had some snow like this, and maybe like 4 years ago, we had some snow like this. But it's also really, really cold outside. And that's something unusual because usually in Texas, it warms up in a couple days, and now it's staying cold for like a week. So this is something that we are not used to. So I hope everyone's staying warm. And before I begin this town hall, I want to do some introductions really quickly and just give a quick thanks. Dwight and Swati, can y'all like either wave or say hello real quick? Dwight and Swati.
Hi, everybody.
Dwight.
Happy Valentine's Day.
Yeah, thanks Dwight and Swati. Dwight is a former Richardson precinct chair, and he's an activist in the region. And he's a member of American United PAC, which engages our diverse community in the democratic process and social justice. And Swati is an activist for They See Blue, which is an organization that mobilizes South Asian Texans for democratic causes. So Swati and Dwight, I could not have done this town hall without you both. Thank you so much for being just an incredible help to me in making this town hall possible. Thank you so much for your help. And Swati, we're having a Q&A in about 40 minutes after our discussion, and you're going to be kind of helping with that section, right, for the Q&A?
That's right. So if you have a question, please post it in the Q&A box that's located at the bottom of your screen.
Okay, yeah, awesome, Swati, thanks. So if you have any comments, please give them to us. I want to also introduce Jeannie. How are you, Jeannie?
Hi.
How are you doing? It's great to see you. Now, Jeannie, you're a resident here in Collin, and you're a real light of warmth and love in this county on Valentine's Day. And after I finish my intro, we're gonna hear a song from you. Is that right?
Yes.
Okay, fantastic. I'm looking forward to it. I heard in rehearsal, so it's really, really good. I'm really excited about it. And I also want to introduce my panel. First, we have Prakash Parameswaran. Can you wave, Prakash? Prakash and Dr. Samad Khan. Dr. Samad, would you wave and say yourself? Thanks, Dr. Samad. Dr. Samad is a doctor here in Collin County in Frisco and practices family medicine. Prakash is a resident and who has been synthesizing our COVID data from the state. And he's been sharing it with the entire county so that they can make informed decisions about COVID. So Prakash and Dr. Khan, I want to thank you very much for joining us too. I'm really happy to be talking with you today. Thanks for taking your time to speak with us today. Really appreciate it.
Thank you.
And finally, we have Dr. Amir Shaquille. Hi, Dr. Shaquille. How are you today, sir?
Hi, thank you. Doing good.
Thank you. Dr. Shaquille is a doctor of family and community medicine, and he has the endowed title of Dr. Bill Ross Professorship in Family Practice at UT Southwestern. And he also serves as Texas Academy of Family Physicians. So Dr. Shaquille, I'm really honored to have you here, and I'm really looking forward to speaking with you today. Thank you for being here as well, sir.
Thank you.
Well, I wanted to say something before I go on. I want to thank you for being on my health panel. You all are experts in health and medicine, and you're incredible experts. And there's something interesting that the audience may notice, which is that we're a little bit male dominated today with our panel, which means we need to make sure we're thinking about the missing women voices in the room. In order to balance the panel, I'll go ahead and close the membership to men from now on. And in the future, the next 4 or 5 members are going to be women. So they'll comprise the majority of the panel after today. So I appreciate you gentlemen being here today with us. One major reason I'm running next year is this COVID crisis. Over the last year, I've seen and I continue to see and hear just the frustration and the confusion of so many people in the county about how our commissioners have really sort of failed about what they're supposed to do, which is health, safety, and crisis management. And first, last year, the safety measures were very confusing. They didn't really send the right message for people on how to be careful and how to avoid the virus with the mask wearing. And now we're seeing the vaccine delays. So we're seeing the same kind of thing happen in year 2 of this crisis. And they seem to be really dropping the ball. And so over this time, it's been really crystal clear to me that with better and more proactive leadership, we would be doing way better. And so that's why I'm running for this office next year, because we really need a commissioner's court that we can trust. And too often the commissioners have just sort of dropped the ball on the COVID response and the planning. And I've talked to at least 2 residents this month who have called the county commissioner's office and asked for a COVID vaccine distribution plan, right? So they looked online, they wanted to see the plan and read it. And they were told by the office that there is no plan. The commissioners haven't made one. And that's a big breach of trust. I want to restore that trust to the commissioner's office and bring back, just some basic professionalism and competence back to the county, because I believe that we deserve a good government and smart government, and so that we can save lives, literally. And so that's what I want to do. I want to work hard for the trust for this county. So I'm going to speak for about 2 more minutes about what this town hall is about, and then I'm just going to ask questions to take notes from there on out. So if you came to hear me talk during this town hall, this is pretty much going to be it before we start our panel, and most of the experts are going to do most of the talking here. And before I begin this town hall and talk about what it's going to be about, I want to wish everyone a happy Valentine's Day, full of love. I hope you all are giving love and receiving love today. Valentine's Day, of course, is named after Saint Valentine. And if you're not familiar with Saint Valentine was a man who allegedly spent his whole life healing the sick. He would travel from community to community healing sick people. And I learned this week that there's actually a festival in France that celebrates Saint Valentine, and it takes place the week after Valentine's Day. So if you're in France, you can celebrate Saint Valentine's Day today and then a week from now. And it's believed that this festival increases the health and wellness, not just of the people, but of course, in France, as you know, where they're located with their vineyards and their grapes that they grow, they also have the festival in honor of the health of their vines and their grapes as well for their wine. And so, so in the spirit of St. Valentine's Day of love and healing, this town hall is going to be about COVID and how we can help our community stay safe, stay healthy, and stay alive. And it's going to have 3 purposes. First, I really want everyone listening to just leave this hour with more knowledge than when you started. Right. I hope that you'll learn a little bit more about COVID than you didn't know before from our experts and what it means for our community. And number 2, I'd love all of you to participate in the town hall. So I hope you'll write your comments and take notes. That's what I'll be doing, taking notes and actively listen and just be all in for this town hall. And ask yourself questions as you listen and as we have conversations together with our experts. And finally, after this town hall, I want you to stay tuned in. Not only to this campaign, but to our Facebook page. After this town hall, I'm going to develop a few ways that we can work together to help our community in the next few weeks and months. I think we need to take some action about about COVID now, so that we can stay safe and healthy better. And so you'll see a call to action to help our community. So so definitely go ahead and look for that. Well, I think we're about ready to begin. Jeannie, we'd love to hear your song now, if you're ready for it.
Well, thank you.
Sure.
I guess I need to be unmuted. There we go.
Yeah, we can hear you. We can hear you fine.
Hello, everyone. I just want to repeat what Scott said, that we're having this on Valentine's Day to express love and concern for the community and have a meaningful discussion on the COVID virus and the vaccine rollout. I wrote this song back in March. It was at the beginning of the shutdown. And I wrote it to offer some words of hope and encouragement that if we all follow the guidelines, we'll keep ourselves and others safe, and we'll get through this pandemic together. And the song is called Everything's Gonna Be All Right. Everything's gonna be all right. Everything's gonna be all right. Though it's hard for every woman, child, and man, wear a mask, keep your distance, and wash your hands. Down the road, it'll be all right. Some folks are gonna need some help. Lots of folks are gonna need lots of help. Ain't no doubt we're in a terrible fight. Doctors and nurses working day and night. hard to make everything all right. You can cook, you can read, plant some garden seeds. You can play, work at home, call a friend on the phone. School's online, so the weather will be fine. Keep your eye on the prize, though it's hard to realize. But right now we need to stay at home. If you can, you need to stay at home. Later there'll be time for everyone to roam. But right now people need to stay at home. Everybody trying their best to make it come out right. It's the only way to keep the virus at bay. The whole world wants to see that wonderful day. When the COVID cloud lifts, we'll be thankful for that gift. Take it day by day, lift your head and say, everything's gonna be all right. Everything's gonna be all right. Down that road, that beautiful road, everything's gonna be all right.
Yay, thank you, Jeannie. Amazing. Your voice is so beautiful. I got to hear that twice, one during rehearsal and one now. Thank you. You're going to do one more reprisal, right?
Yes.
Okay, thanks, Jeannie. Awesome. All right, well, I think it's time for our first two panelists, Prakash and Dr. Samad. So Samad and Prakash, Dr. Samad and Prakash, thanks for being here again. And I don't want to bury the lead here. I want to start with the most important thing. We have about 30 attendees on Zoom, and more people are watching us on Facebook Live. And I think this town hall is going to go viral. So by the end of this week, I think 1 million people or more are going to watch this video probably. So what is the most important thing that you want people to know about COVID right now as an expert, you know, as someone who's looking at this data and looking at the science behind this right now before we are? What do y'all think is the most important thing that you would want all of Collin County to know right now? What would it be, guys?
So this is Prakash, right? So let me just summarize what we need to keep our eyes on. So we are almost like a year and maybe a month or two into the pandemic. And at this point, you know, it's really important that we keep our eyes on the following metrics, right? We need to make sure we understand what the trend is for the new cases, what the 7-day average is it increasing, decreasing? What does that mean? Then we need to understand what, how the hospitalizations are in our county. We need to understand, how many people are passing away, just so we can understand the seriousness of this. And besides that, we also need to understand the transmission rate and the positivity rate. And we need to understand what these numbers really mean. So for example, if you say that Collin County today is doing around 450 new cases a day as a 7-day average, what does that mean? If you ask the average resident, do they understand, whether it's safe, whether it's not safe? So that kind of understanding is missing in the community. So I feel, our county commissioners and, the county judge, they've not, done a good job explaining all this to us. So even, for example, with this number of 450 odd cases every day, we are well above the 250 mark that schools of public health have established, where they say that once it goes beyond that, you need to have a shutdown to bring, things back under control. So there is no understanding that people need to, get the case numbers below 10 per million population for it to be considered safe. And even then, it's got to be done with adequate community, with adequate contact tracing. So that's, the understanding that's missing that I feel everyone should, try to understand. So besides, the data, then, understanding what the data actually means. For example, our positivity is around 13%. So that's really high. I mean, that's something we want to bring down, because what that means is, we're still in community transmission and it's quite extensive. And then besides the data itself, there has to be an understanding that the virus itself has mutated, right? So we're not like, dealing with the virus of 2020. We're now looking at the virus in 2021. And guess what? There are 3, mutations out there that are of concern. And these mutations, especially the one from the United Kingdom, it's called the B117 variant. I think many people would have heard of it by now. So that has a transmission rate. If you remember, I mentioned the transmission rate is like around 0.9 in Collin County right now. But for the new variant, it's almost like 0.4 to 0.7 higher. So if you're not careful now, we could end up in a situation where the transmission rate goes above 1 and we'll have increasing cases again. So that's the kind of understanding we need to have, that there's, not the pandemic of 2020 going on, but there's the pandemic of 2021, which has these variants from the UK, from Brazil, and from South Africa. And all these variants are, in transmission in the United States right now.
How about you, Dr. Khan? You've seen plenty of COVID cases in your practice. What's
Yeah.
something you want everyone to know?
Well, thank you, Scott, for the opportunity. I think it's very important for us to be having this discussion at this time. The biggest message is don't let your guard down. I know it's really easy to get excited and we're seeing nationally the numbers going down and, more and more people are getting vaccinated, but the risk is still there. And, I think more people, from what I've seen are venturing out and going to restaurants and having parties and things like that. And it's still important to recognize, social distancing, continue to, double mask, continue to take precautions that we've been taking, and we'll get through this soon. So really that's kind of the takeaway, just if you're going to take one message is, don't let your guard down.
Thanks, Dr. Khan. So Dr. Khan, we've seen a lot of news documents recently that we may be able to project in a minute, and it documents a lot of the failures that the Commissioner's Court in Collin has done in mismanaging the response to the COVID. And in our talks before this town hall, you and other doctors have tried to contact the Commissioner's Court to give them advice, and you really haven't gotten anywhere. What's on your list of better ways we can manage the crisis in Collin County? What advice have you given them? What should we be doing?
Yeah, so it's been a little bit unfortunate, even with testing. We really did not have a plan in the county, and as individual physician and physician groups, we took the onus to really get testing going. And unfortunately, the same thing's happening with the vaccine. From the latest numbers that I've heard from Collin County, is that they're getting about 2,000 vaccines a week allotted to them, and they're just distributing them to local fire departments and shelters and things like that. And as a physician, and I think Dr. Amir will attest to this, that we believe that we're the best equipped to be able to provide the vaccine safely to the community. Most people have their local family doctor, provider that they go to regularly, and very few physicians have gotten an allotment. We actually just got a notice that we're going to be able to put the number of allotments that we want, but really there's no time frame in terms of when we'll be getting our allotment. And it's unfortunate because we get hundreds of calls a day at our office, our multiple offices, to see whether or not we have the vaccine, and people are traveling across the state to different counties. I have a lot of patients that have traveled, unfortunately, long distances to get the vaccine, in the 1A, 1B group, and we should have the resources here to be able to provide that to the people that live in this county, and so far it really hasn't been the case. People are able to go, to the fire departments locally, maybe to get a vaccine, but even they don't know when they're going to get their next allotment. And so because of that time frame or lack thereof, there's a lot of confusion and apprehension when it comes to the vaccine. So, that's something that I would, if I was able to, speak to the county commissioners, let them know that, it would be best advised to give us a plan at least, or a time frame, and that way we can then provide our patients the opportunity to sign up and register, and at least know, hey, even if it's a month from now, at least they'll know, hey, a month from now I'm going to be getting, the vaccine, so they can start planning their lives.
Okay, thanks, Dr. Khan. Now, Prakash, the audience might not know what a great service you've done for the county, where you've been posting a synthesis and analysis of the state data that the state compiles from COVID, and most county commissioners in Texas, most counties are taking that data and posting it for their county. Now, back last August, there was a slight problem with the data. There was a slight error. And instead of just kind of rolling with that and continuing to post the data for Collin, so that we know, locally, not just in the United States or the world, but, right around our neighborhood, how the cases are going, they just like stopped posting the data. In fact, they didn't stop posting the data. They just stopped posting the data completely and sort of just gave up. And so you've been doing, a tremendous service for posting this data, and I've been sharing this data on my page too. What is your advice for the county to make sure that the residents of Collin understand this data, and how important is it for this data to be shared with our residents in Collin each day or each week? Can you talk a little bit about that?
Sure. So as I was saying earlier, right, it's important to understand what the trends are, what's happening with the pandemic. And I think, first and foremost, our county officials, they need to embrace the responsibility associated with public health, and they need to take it seriously. And that's one area where, we have been let down very badly. And the county judge, the commissioner's court, I don't believe they have been taking the issue with masks and distancing seriously. I haven't seen them come out on social media urging people, giving them the correct guidance, because after all, this is a pandemic associated with a novel virus. So I think, there has to be the attempt on the part of the county officials to understand what it means and make sure that the residents are properly informed. And I don't believe we've seen that. And it's not just that. I think they've also gone out of their way to thwart the efforts in a way. I mean, I remember seeing, the edict from Abbott for the masks and distancing, and also for the gatherings, right? He banned gatherings more than 10. But then I was surprised, to see, our county judge within like 2 hours of the governor issuing that edict, he turns around and he says, oh, this doesn't apply to Collin County. But the fact was, it applied only to the unincorporated portions of Collin County. So that, is a form of miscommunication to the residents. And our mayor in Plano had to jump in and say, hey, this doesn't apply to Plano. We still have that ban on gatherings more than 10. So that was, one concern that I had. And then, you had the issue with the data that you just mentioned. So we had, confusion with the number of active cases, but the actual new cases data was never in confusion. And whatever confusion was there with the active cases, that got sorted out in I think it was in September. So I think by October, the county commissioners could have decided to share all the data on the county website. But instead, they post that message that says our data is not reliable, and they create confusion. And the first thing in a pandemic that you want to avoid is to create this type of confusion. So that's, the things that, our county officials need to help us with. They need to embrace the responsibility, as I said. They need to understand the science associated with a novel virus, make sure that people are, are following that. And they also need to share the data on cases, hospitalizations, deaths. They need to constantly urge people to follow best practices, masks, distancing, hand hygiene, and then, as you mentioned, we need to have a plan for the vaccine distribution. So vaccine distribution for Collin County, you're talking about something like maybe a million plus residents, and we have seen that there's been a reactive response. I mean, we had all of December to plan for vaccine distribution for the people in the first two categories, but we never saw any plan. And then by the time the vaccine started coming around, it was a state of confusion, and then everybody was scrambling to get on, several websites. So we saw that, and then now my concern is, when the when large numbers of vaccines are suddenly going to become available over the next couple of months, I don't know if there's a plan at the county level to distribute it among the remaining people, right? We have like maybe 800,000 people that may need vaccines. So that translates to maybe 1.5 million doses that need to be distributed. So those are, I think the things that they need to keep in mind and address this pandemic properly.
Okay. Yeah. It's been really disappointing to hear from residents who call the office and try to find a plan, and there is none after all this time. You'd think like last summer when things were, we had our second wave and our third wave, you'd think that they would have wanted to develop a plan if and when the vaccine would come, which ended up coming a couple months ago, and that was really unfortunate. And you touched on a couple other things about the relationships with the cities and the communication. I think both you and Dr. Khan touched on this communication issue where people just weren't really understanding what the risks were and even what the data was, and it was just a very confusing message all around. And on the underside, the part that we don't always see as a resident is the relationship that the counties and the cities have together. The counties and the cities are supposed to work as a team in a lot of ways for the safety and the health of our area. And lo and behold, we had the city of McKinney, one of our cities here in Collin, brought a lawsuit against the county commissioners court because they weren't happy with the way that the way things were going between the city and the county, and that was really disappointing too. That isn't supposed to happen. They're supposed to be working together very well, not having throwing lawsuits at each other. So that was really really disappointing to see. And Dr. Khan, I had one more question for you. And now that residents are receiving the vaccine, the 1B and 1A groups, the 65 and older and at-risk groups, what do residents need to do to get to the vaccine at this point? And as far as talking about safe behavior for people after they've gotten the vaccine. So after they've gotten the vaccine, what's your guidance about safe behavior for them if people have already been vaccinated?
Sure. Well, I mean, right now, for Collin County residents, you can go on to their website and they'll give you you can be put on a waiting list. I think in the next maybe 2 to 3 weeks, you'll start seeing the vaccine being distributed to your local primary care physician. There's a bunch of us that have, gotten our username and passwords, and put our numbers in for the allotments, and they're going to be rolling out pretty soon. So I would tell local residents to not, mostly in this weather, not travel too far, kind of wait maybe a week or two and call your primary care physician, and they'll be able to give you a lot more direction in terms of being put on their list and getting the vaccine that way. It's for us, it's I feel like it's a lot safer to be able to distribute a vaccine at a doctor's office. We're all well versed in doing vaccinations. We have protocols in place. Adverse reactions do occur. You can have anaphylactic reactions to the vaccine, and so it's important for people to be prepared. And who better than your local primary care doctor? So I would say contact your local primary care physician, and they should be able to give you proper direction in terms of when they're going to get their allotment. And really what to do after the vaccine. So it's not that you get the vaccine and you're become Superman within a few minutes. It actually takes a few weeks for the antibodies to fully develop. And the data is obviously just coming in now, but it looks like older people have less of a response, and that's something that we were worried about. But as you get older, your immunity in general decreases. So older people actually will have, it'll take a little while, even longer than 2 to 3 weeks for them to be fully inoculated. And even then, depending on what vaccine you get, there's still 10 maybe even 15 or 20% chance that you could still get the virus, right? And now with the new mutations that Prakash was talking about, I still think that it's very important to, to continue to, use social distancing, wear masks. When things do open, there's a lot of corporations that are planning on opening their doors. Have a plan in place for testing, continual testing. I get a lot of calls now from companies that are saying, "Oh, well, our employee got the vaccine, and they're not feeling well, but they shouldn't get tested." No, that's not the case. You should still be able to get tested whether or not you had the vaccine, because you can still get the virus. What to look for after the vaccine? I'm sure there's a lot of people that hear, different stories of people getting reactions from the vaccine. It is common to develop, some sort of reaction, either a localized reaction, which is, arm pain, fatigue, to, having fever, chills, body aches for, up to 2 to 3 days post-vaccine. So, if you do get the vaccine and you do get sick, we should assume that sickness is coming from the vaccine, but you could also unfortunately have gotten COVID as well. So I wouldn't rule out testing. If you're not feeling well and it's lasting more than a day or two, you should probably still go get tested for COVID at that time. So, there is optimism that the vaccine will begin to roll out to local physicians in the upcoming weeks. So I would, recommend that residents do call their primary care physician to ask about the vaccine, and then to continue the protocols in place, with the social distancing and mask wearing at all opportunities. So really, that's.
Yes. So I think Dr. Khan, I think you made a really good point there at the end, and I just want to emphasize that the vaccines protect you from moderate and severe disease, but they don't completely protect you from infection. So you could get infected after you have been vaccinated, and you could transmit it to other people. So for example, if there's like multiple people in a household, and let's say, there's a couple that, have already been vaccinated, then if they go around and they practice, they go around without masks, they ignore distancing, they could contract the virus, bring it home, and share it to the others that have not been vaccinated, and they could have severe outcomes. And I think the good news, though, is that the vaccines do help. I mean, some of the initial data coming out of Israel, I think they looked at about 500,000 people that have been vaccinated with both the doses. And they found that, just maybe like, 400 or 500 of them got infected, after the 2-week period. And even out of those, there were like maybe 30, 40 hospitalized, but there were no deaths. So I think the news on the vaccines is very promising, but you have to emphasize that, people continue with masks, continue with distancing and hand hygiene, even after they've got the vaccine.
Okay, yeah, thanks, Prakash, and thanks, Dr. Khan. Yeah, very important points, and I appreciate that. And Dr. Khan, a little bit of an update. I think last Monday, the County Commissioners Court actually shut down their sign up for vaccines. They voted unanimously and voted that the line is too long and the vaccines supply is too short, and so they aren't taking any more signups anymore. Now, you'd think that for a county that's in charge of the safety and health of the county, you'd think that they would want to know who wants a vaccine, even if, I think people understand that the line is long and they're gonna have to wait a few months and longer, but you think that they would want to know exactly who wants a vaccine right now, and they'd want to keep that data. So sadly, they actually are not taking reservations right now, and that's going to be, I think, one of our calls to action after this meeting. I mean, that's just a complete dereliction of their job completely. So we're gonna. I think
most people are, unfortunately, from Collin County are going to other counties to get vaccinated, which is,
Yeah. Well, thanks, Dr. Khan and Prakash. I really appreciate y'all's input. I think we're gonna move on to Dr. Shaquille. But before I do, I wanted to introduce a special guest here with us today. Kathy Chang, are you here? Can you hear us?
Yes, I am. Hi, Scott. Hi, everyone.
It's great to see you. So Kathy was our Texas Supreme Court nominee in 2020. And Kathy, I have something for you right here. I got it out of my car and I didn't slip. Here's my sign. Do you like it?
Love it.
I was thinking to myself, if I go to my car and I slip and fall before my town hall, I'm going to be in big trouble. But I didn't. I got it. I got it here. So, thanks for being here. Do you have how are things down there in Houston? Are things as cold as they are down there as they are up here?
Great. Yes, it is cold. But I want to say first, I want to thank Scott for having me join this conversation. Because when I first heard about Scott, you running for this position, I couldn't be happier because a lot of people don't understand just how critical the county commissioner's position is with respect to a county. A lot of people think that it's the county judge, but in reality, when you start having these votes and stuff, the county judge is actually the tiebreaker when you start voting these things. So the county commissioner's position controls a lot of weight. With respect to the COVID situation, I can only speak from Harris County. So I'm in Harris County. I know that when we receive these vaccinations in Harris County, a lot of the citizens here, the senior citizens, are not going to get the vaccination. From my understanding is that there's a lot of misinformation out there, and they don't understand what are the side effects, some of the issues of what's to come later on. And that's one of the things that I think I don't think that Scott and any other Democratic elected officials, when you guys go through election, would have any issues, because we as Democrats know that information, the correct information, is the key, not just the infrastructure of what to do and how to contain the situation, but how to implement once we have a plan on implementing the vaccination. And that's why when I heard that you're running, I said, I am 100% behind you, Scott. So I'm endorsing this publicly, that I am behind you 100%. And for those of you in this call, please, after the call, donate to Scott Coleman for County Commissioner of Collin County. Thank you.
Thanks, Kathy. I appreciate it. Thank you very much. I appreciate it. Thanks for your support. We love supporting you last year too, and we hope you stay safe and healthy in Houston. Appreciate it. Well, let's move on to Dr. Shaquille. Dr. Shaquille, it's great to have you here. And I've introduced you, and I also wanted to thank our frontline medical workers, of course, who are working so hard, our nurses practitioners, our doctors, our healthcare workers, everybody who's working so hard. Now, Dr. Shaquille, like Kathy, you actually had a personal battle with COVID. So you actually had COVID. And so you've seen it both as a doctor and a patient, Dr. Shaquille. And, they always say, like, you should, if you're a lawyer, you should never be your own lawyer. And I know from experience that my wife and I are teachers, and we did not like teaching our own kids. How was it? How was it with you, like being a patient with COVID? Can you tell about that experience as a doctor, seeing it from the other side?
Sure. Well, I was, you could say, I guess I was lucky that I have a lot of support from community physicians and from university. And, everybody was actually helping and guiding if I needed. And so, and I got, I think because of that, and I got, treatment early on, and by recognizing the symptoms, I was able to, during my 2-month illness, I was able to stay away from the hospital for most of the time, because we do have, some colleagues who actually got infected, and one of my long-term colleagues, he actually didn't survive. So, it is a very, very serious illness, and it's variable in every person. You cannot predict the response, to what extent they're going to go, how strong the inflammatory response their body is going to generate. And it depends on the age and the other conditions. But, it was, in my case, I personally think that, it was a terrible illness, but, I was, supported by the colleagues and community, and there was a lot of love and care, and people would drop food and, send notes and call for anything I needed. So we feel that it was a blessing in that regard.
Good. That's fantastic. Now, Dr. Shaquille, you've written about the best practices. You've actually written about practices that a city and a county can use to manage the COVID crisis. And in terms of like areas, like one is identification, one is isolation, one is intervention. How do you think your program, that kind of program, can help Collin County residents, and how can they inform the cities and the counties in helping the residents with this crisis this year?
Sure. I think there is again, as you've been and your panelists been discussing, there's a lot of misinformation, and there's lack of guidance. So what I wrote about is that identification is, every single patient who we suspect, could have contracted the disease or contracted the virus must be identified. And what I mean by that is that we often ignore that in the community, especially the children. And I have, I mean, there are many physicians I know in the audience and doctors, some are there. We have all treated people. And in my case, in our clinic, we at least 2 patients I remember who got infected from the grandkid who got it from the school. And the grandkid is fine, but one patient actually ended up in ICU, and the other grandmother actually passed away due to COVID. So to think that, okay, children are fine and they cannot, you know they cannot get a severe infection, but they can be carriers. So, and that what we saw in our clinics is that a patient would come and say, oh, I got exposed and I'm getting tested and my husband is getting tested, but they don't get their children tested because somehow there's a perception that the children are immune and they're just fine. All children may do fine, but they still can carry the disease. So that's what identification means, that every single person need to be identified if they're exposed or they are having symptoms. Similarly, see, the other problem is people isolate, but they do not isolate younger or either completely, or they don't have the circumstances. The worst part of our communities is actually the people who got most serious illness and worst outcome were people who are again underserved and uninsured. And one of the things is that why it is so badly hit in that areas is because they cannot, sometimes they don't have the opportunity to do quarantine in a stricter sense. For example, they may be living in an apartment with 1 bedroom, or and the whole family lives together. So those things, and we see that in Parkland is very, very common. And so isolation, or people don't understand and they do not isolate. And especially now with the vaccine, there is this false sense that I got the vaccine, so the whole household is immune. That's not true. So isolation of, again, every in a strict sense, in the strict sense which CDC has recommended, is very, very important. And the next step is intervention. I think that's where we actually, as a nation, my personal opinion is that's where we have failed more than any other areas. And what it means is that we wait for, like typical American medical history. We wait till we get really, really sick, and we go to the ER and we go to the hospital. Now hospitals are overloaded, the ERs are overloaded, and they have actually turning people away, just doing minimum. Okay, you go home. When I got sick and got admitted to the hospital, that night there were 80% of the patient in the ER were due to COVID. And we're talking about a Plano Presbyterian hospital, and they were overwhelmed, and they did not know how to manage all of this, not because they didn't have the resources, just too many patients. There were patients in the hallway. There were patients who were coded, being coded for because they couldn't breathe. And so what intervention needed to be done is at the outpatient level: early detection, aggressive treatment, education, and making sure they're following the first 2 steps. So we have less and less people going to the hospitals. And lastly, last step is actually the immunization. And I think other panelists have touched a lot on this, so I won't go into detail. But to think that the vaccination is the complete solution is a misinformation. We need all steps as discussed before, in addition to vaccination. Now, I would just say one more point on the availability of. I'm also the president for Texas Academy of Family Physicians, so working with the 2 local chapter, Dallas and the Red River, which includes most of our Collin County cities. We have just drafted a letter for the governor's office, and we're working with the local lab in Frisco, which they can store up to 250,000 doses, and we're requesting to allocate those, vaccination to primary care, so we can administer to our patients, as Dr. Khan was talking about, and their families. And we're also working with faith-based communities. So we really need to work at all levels to have this vaccine first available and then administer.
Okay, well, thanks, Dr. Shaquille. That's great. That's great advice. And you touched on a couple of things I want to mention at the very end of this program in just a few minutes, going back to the communication in a lot of ways and making sure people understand what's going on and how to, how to seek treatment if they need help. So I appreciate this panel. Swati, I think we're ready to go to some Q&A. Have you been keeping track, and do you have any questions questions that we can pose to the panel?
I have a ton of questions, so get ready.
Oh, okay.
Okay, so let's see. The first one is from George. It was submitted before the webinar, and they would like to know how schools operate day by day. There are many points of contact, and therefore transmission of COVID-19 is greatly possible. There's credible literature that schools aren't as super spreader venues like indoor dining or other gatherings like concerts. So they'd like to know what is a feasible school operation plan considering the tragic political climate of Texas? And what are the parameters that must be heeded so schools don't become super spreader venues? And I did want to add to this because Alyssa Klein mentioned that her child's elementary school has seen 0 transmissions on site. It's a school of about 400 kids. So just wanted to add that because I saw the comment in the chat. So whoever wants to take that.
Yeah, I'll just, but before any of the panelists chime in, I'm an educator and I work in a school district, and I was really frustrated with, again, the state government and the county government who weren't just intimating that children couldn't get infected, but who actually outright questioned it and said that children can't get infected several times on Twitter. I think maybe John Cornyn, our senator, or a few other people cast doubt on whether children could even get infected in the first place, which by the time they posted that, I think it was sometime in the summer, like in August, when we were returning, we were certain that wasn't true at all. And so now school districts, I can say from my experience, have taken a lot of different tacks. Some are completely online still, and some are a mixture of both. Dr. Shaquille and Prakash and Dr. Khan, what have y'all noticed good, things you recommend, things you don't recommend from schools? We have about 3 or 4 months left. What are they doing well, and what would you recommend for them to do in schools to keep this going?
So Scott, I guess the point about transmission in schools, the data from last year, if you look at it, Israel did a really good job with containing the first pandemic in the March, April, May timeframe, and then they opened the schools, and then their numbers went up drastically. So I don't know if it's entirely accurate to say that schools are not centers of transmission. So that's one side of it, right? So the other side is obviously kids need to get back to school, and there's a crisis that's been unfolding, and that's going to be resolved only by getting the kids back into school. So to that end, I think the CDC has provided some guidelines, and they seem to be fairly well thought out. I believe the only point that's missing there is adequate ventilation. So I don't know what steps are going to be taken to address that in our local communities, but otherwise with all the other precautions followed and with proper ventilation added, this is something that could definitely be considered for the next school year, and the goal would be to get everybody vaccinated before all that happens. I think that would be really the best path to follow. That's kind of my opinion.
Dr. Shaquille,
I would caution people that, as I was saying, that, this is a false assumption, first of all, that the children will not get infected. That is not true. We've treated children in our clinic, and, not one or two, many children. And they do have, some of them actually got pretty sick. Most of them do not get sick. The younger they are, there is a reason for that. They don't have the receptors which create this significant inflammatory response. But that is, again, they can be they can have the disease with mild symptoms and can pass on to the others. And again, I can give you example after example. I treated school teacher who got it from one of his, kid in her class, and then she had three of her own kids, all of them, and the grandmother, everybody got infected. And again, children didn't have that much symptom. We didn't have to put them on medications, but we had to treat the grandmother and the teacher. And so this is, again, if you think that, oh, schools are safe, they gotta follow the best practice. I understand that, children need to go to school, but if you look at the countries who have controlled this pandemic with least amount of resources, is that they didn't have vaccination. Nobody had vaccination at that time. It is against the social distancing rule implemented, the way they should have been. And this last week, there was a, double masking recommendation. So it is not over. It's getting worse. We have this false sense of, I personally think it because after the two big, holidays, there is this, we're going through a false period where people actually travel and they're now at home, and they're after 2 weeks or 4 weeks, now they're getting back. If you just got out yesterday in Plano, it was more busier than I have seen in 6 months. The roads are so busy and everybody's everywhere. And I don't know if they were preparing for the snow or whatever, but when you have people out like this, this is going to come back. So we have to assume that, yes, children need to, if they're going to school, they have to follow all the same social distancing rule, hand washing, masking, everything.
Yeah. Okay. Well, thanks, Dr. Shaquille. I want to recognize Lisa, who gave that great comment about her school. She's a candidate in Plano, so please support her for city council in May. And we also have a lot of other great guests in this audience today. From the Americans United PAC, we have Dr. Tariq and Shakat, Ijaz, Zufki, and Amina Raab. They are with us today, so welcome to all you guys from American United PAC. We're so happy to have y'all here to support us. And representing our business community from the Black Chamber of Commerce in Collin, we have Corey Kirkendall. So Corey, thanks for being here today, sir. We've talked several times, and you're doing a great job of standing up for the business community here in Collin and recognizing that this is a health problem and it's an economic problem as well. So thank you all for being here. Swati, I think we have time for maybe one more question. Is there another burning question that you can identify that we can just do one more, and then I'll go ahead and wrap up?
Yeah, so there's a lot of questions and a lot of comments. So maybe we can even answer some of these offline. Would that be possible?
Sure. Yeah, we'll keep the
So I
conversation
think,
going.
so I want to ask two questions because I'm very curious about this as well. The first one is, what's the progress on hybrid vaccination efforts? This is by Scott Coate. For example, he says first the Pfizer and then the second dose would be Moderna. And then I can ask the second question after we answer this one.
Gil, you want to take that one? You're the vaccine expert.
There is no study done on this. So, we know that both vaccines will generate immune response. And, early on, it was Pfizer vaccine generated a little bit more immune response and less side effect. And in Moderna's case, some people, because of the little bit more side effect, they didn't want the second dose, and the both are using the same technology. It's just splicing is more accurate, so to speak, of the gene in the Pfizer vaccine. It's much more cleaner in scientific terms, but there is really no data that you got this vaccine and then you got other vaccine and it'll be better off. I think what's happening is people are getting whatever. The people who want to get vaccine, they get whatever. If they get the Pfizer ones and second dose, they can't get Pfizer, they go to Moderna, whatever they get their hands on. And that again just unfortunately shows you how ill-planned this whole distribution is, that there's reports of vaccines being wasted because the vial is open and either people decline at the last minute, or and there's a case in Houston, the doctor is in a lot of trouble because he tried not to waste the dose. And so this is whole it just goes on and on, but there is no data, as I said earlier, that is it harmful or beneficial.
Okay, great. Thank you. There was a question about, getting some clarity on where to sign up for vaccinations, and is there a centralized county website? So Judy Coate put a website, Collin County COVID vaccine. If the doctors, anyone, actually, any of the panelists have some more information on, where people can go sign up for the vaccine. Anyone?
Again, go ahead.
Go ahead. No,
No, I
Dr.
mean,
Shaquille.
I was going to say that there is no effort on the, real effort on this, on the part of the Collin County leadership. It should have been, the Collin County page, and, people, and they should be, and, we are actually trying to work directly with the governor's office, because it is, we've seen cases where, the local governments are not that interested, they're not that organized. And I think the solution which Dr. Khan mentioned a couple of times earlier is that to get it to the primary care physician, family physicians, and other primary care practices, so they can, they know their patient. We can call them, we can send them electronic messages and reminders that, hey, we have the vaccine, come and get it. So I think that will be the best approach, given the efforts we have seen so far from our local governments.
Yeah, that's telling that the president of Texas Family Physicians, doesn't have an answer to that question, and I don't either. It's very unfortunate that we're constantly getting bombarded and called, and rightly so, by our patients, and we don't have anything to give them substantial. It's pretty shocking, but hopefully in the coming weeks. We'll be able to make some changes.
Okay. Well,
Great.
thanks, Dr. Khan and Dr. Shaquille. I appreciate your input. We're just about out of time, so I want to conclude with the call to action really quickly. And as I'm listening to all of these great comments and all this great advice, a few things strike me. First of all the other questions that weren't answered, I think we can keep this conversation going on my Facebook page. I'm a teacher by nature, so I can't possibly let any questions go unanswered. It's not in my nature. It's in my blood to answer every single question that's asked. So you can bet we can just keep this discussion going. And I think the biggest message, I think, is that we really need to restore trust in some kind of system so that people feel that they're getting the right messages and the right data and the right science. So what I want people to do is to keep following my page, because I want my page and my campaign to be a place where people can actually go and trust the information and trust the data. With Dr. Shaquille and Dr. Khan and a lot of other doctors trying to communicate to the county what they know and what they want the county to do, I want all the doctors and all the medical community to know that my campaign and my page is a safe place and a good place for the medical community to give their data and to tell their patients what they need to know. So I think I want to be that reservoir of trust for the patients and the residents of Collin County. I think my campaign will also post the safety measures. Of course, it's always worth reminding people that even natural introverts like me just stay inside. I'm dying to get out too. I like being at home usually, but I want to just go to a restaurant, and I know that I just shouldn't do it yet. And so we just need to stay vigilant on these next few months. The thing that really impacted me today is that there's a lot of frustration about the fact that there's really no messaging on vaccines, and it's really confusing, and people can't go to their primary care physician to get any information about the vaccine. And worst of all, they can't even go to the county anymore because the county just completely shut down the signups. They just decided, well, the list is too long, and we're just going to give up. And so what I'd like to do for a call to action is we need to put pressure on this county government. We need to make them do their job. They're being paid salaries, which are probably more than you think they are, to do this job and to make things safe for us. And so part of my call to action is that we need to hold these county commissioners accountable, and we need to be able to trust them to do their job. And so go ahead and follow my page. We're going to do some more call to actions this week, and we'll provide more updates on how you can be involved. We'd also like to call senior citizens and make sure they've been vaccinated. Some of them have and some of them haven't, and some of them might need help. The people who are really elderly may not really know how to do the whole things online, and they may not even be aware that the sign up is not up anymore. And so they may need a number to call. And so I'd like to start a volunteer effort over the next couple of weeks to call senior residents in Collin County to help them with the information, because if we're confused and we have all this information online to access, then people 65 and older, I think, are probably even more confused with not being able to access that information. So please keep following the page and keep following the campaign. We're gonna get through this, and we're gonna keep clarifying the information and helping people get through. And Prakash, thank you so much for your service in Collin County. Your data is really amazing, and it's helped so many people, and I know it saved lives. And Dr. Khan and Dr. Shaquille, y'all are saving lives too every single day. And I felt very comfortable with y'all. I come from a medical family, and so I sat around many Thanksgiving dinners hearing my family talk just like y'all talk today. So I felt very happy listening to y'all today. And I want to thank my panel for being here. I really appreciate it. And I hope we can do this again and have some better updates in the future. And with that, Jeannie, I'd love you to do another verse of your song. If you'd like to close us out with that, that would be amazing. I think you're still muted though.
Okay, yeah, please unmute.
Yeah, you're good. Yeah, you're good.
Okay. Everything's gonna be all right. Everything's gonna be all right. Though it's hard for every woman, child, and man. Wear a mask, keep your distance, and wash your hands. Down the road, it'll be all right. Down that road, that beautiful road, everything's gonna be all right.
Thank you, Jeannie. Appreciate it. Thank you, guys. Thanks, everybody, for attending our town hall. We'll have another one soon. Y'all stay safe and stay warm. It's still snowing in Texas. Can you believe it? Thanks, everybody. Y'all have a good day. Happy Valentine's Day.
Thanks.
Bye-bye.
Bye-bye.